Hello again, and welcome to Emergency Cardiology. I'd like to introduce you now to Professor Mervyn Singer. Mervyn talks to us today about acute heart failure. Mervyn, perhaps you could start by telling us a bit about yourself and your own background.
Yeah. I'm Professor of Intensive Care Medicine and consultant at University College London, hospitals, NHS Trust, and I have a major interest in haemodynamics and haemodynamic monitoring.
Good. Now, why is it so important for the emergency room doctor, an emergency physician, to understand about the management of acute heart failure?
Yeah. I think for two reasons. A, obviously we want to do the best by the patient and try and obviously improve them both symptomatically and improve their outcomes, but also I think we need to better understand the physiology and the pathophysiology of heart failure, because I think a lot of the things we've traditionally done to the patient actually are detrimental, and so a better knowledge of the physiology and how the pharmacology modifies that will be to the patient's advantage.
So is that what you deal with in your lecture today?
Yeah, absolutely. So I take people through the potential evils of giving a diuretic, for example. You know, that's long enshrined as standard textbook medicine, but there's a lot of data out there to actually show that perhaps it's not as appropriate in many patients with heart failure. So it's just talking through when and when not a diuretic should be given. The same with an inotrope, the same with oxygen. So it's talking about things that we should perhaps best avoid, but on the other hand, things we could think about using, like nitrates, non-invasive ventilation, and so forth.
Okay, so you talk about the therapies and tools that they could practically use in their own practice in medicine.
Yep, indeed. So it's a sort of evidence-based, physiologically based guide to diagnosing and managing heart failure.
Fascinating. Look forward to hearing it. Thank you very much.